Audio Jungle. Audio Jungle. Audio Jungle. Well, once again, we say thank you for keeping it Three Stones TV. This is another edition of the MedFiles program. I am your host, Marianne Waisha. I have in studio Dr. Paul Wanjohi. He's answering the questions we have from you for this edition. As you know, the MedFiles program brings you answers to questions that we have from you. We have people just like you who ask questions about, random health problems, usually problems that wouldn't be serious enough to take you to hospital, but perhaps you need information on. Dr. Wanjohi is answering the questions we have. Dr. You are almost part of us now.
Yes.
Last time we answered some interesting questions on eggs, on backache. So this week we have some of those questions that I'm sure you get a lot, where people say, it's not me, it's a friend of mine, but I'd still like to know. Either way, it's fine. We'll be answering those questions.
Okay.
So let's start as they came. Another one of those.
Yeah.
We don't know who exactly it is, but this is a question asked by a young man.
Yes.
And he asks about pain when passing urine. Like, is that fine? Is that something that should be alarming? Because he says either himself or whoever, wherever he got the information from,
Yes.
but we'll still answer the question. Experience some pain when passing urine, but it's not all the time. Like sometimes this person will go to the bathroom and it will be quite normal, quite comfortable, and then the next time there'll be some pain while passing urine. Is this something that should be taken as something that should be alarming to him or whoever it is, and then after that maybe what could be causing that?
Okay. In men, sometimes you can experience a bit of discomfort on passing urine. Once in a while, it can happen, and then it disappears. And that is usually a normal thing. You'll notice that maybe you've had a bit of discomfort, but the following day, or probably even after a few hours, you should not be feeling anything after that. But if you're having discomfort, pain on passing urine, and you're noticing that this is frank pain on passing urine, which even if it's intermittent, there is a pattern, there is a history that you can ascribe, that you can think back and see that this is something which is happening. Probably that's something which needs to be looked at. Because when you have pain on passing urine, you want to rule out some things. And one of the things you have to rule out is something which is called urinary tract infection. When you have a urinary tract infection, this is an infection which infects, it's a bacterial infection of the bladder, which sometimes can ascend all the way up to the kidneys. And the symptoms usually are discomfort on passing urine, feeling like you want to pass urine all the time. Sometimes you feel like you notice the frequency of passing urine has increased. And when you go to pass urine, even after passing urine, you still feel like there is urine. So you have a sensation of incomplete emptying of your bladder. If you notice this, you might be having a urinary tract infection, which needs to be investigated, because urinary tract infections in men, unlike in women, in men they are not common. When a man gets a urinary tract infection, they might have a structural abnormality of the urinary system, which might need to be investigated. Something else can be causing that, and this is something called urethritis. Urethritis is a sexually transmitted infection.
Yes.
And it manifests with, the manifestations are pain on passing urine and a discharge. Now this discharge, there are mainly two types of urethritis. There is something which is called gonococcal urethritis, what we say gonorrhea. And then there is something which we call non-gonococcal urethritis. Gonococcal urethritis, the discharge is marked. Somebody will notice there is a discharge here. I'm having a lot of pain on passing urine, but I'm seeing something which is a discharge. But you can have something called non-gonococcal urethritis. Non-gonococcal urethritis, the discharge, many times it's there, but the quantities might be so little, you might not notice that there's a discharge. So that needs to be checked. Because if this urethritis persists for a long time, over the long time it can damage the path, the urinary path. And it can cause things which are called strictures, such that urine is no longer able to pass through freely. And the treatment for that is surgery, and it's one of those surgeries which you don't really want to have done. Yeah? The other thing which makes it important is if somebody has chlamydia urethritis. As we have said, chlamydia urethritis, the symptoms are not really very marked. Somebody might assume that probably this is nothing. They can still transmit it. And if you transmit it to a female, in females, chlamydia urethritis, many times there are no symptoms. So this is this is a female who now will get the infection, and she will not know that she has an infection. But the infection is still causing damage. And eventually the infection causes damage to the tubes. And when that happens, this woman now gets infertile. And this is the commonest cause of something which we call secondary infertility. Somebody who used to bear children, then suddenly they realize, I'm not getting pregnant. I'm not Then you investigate, you find that the tubes are blocked. And the tubes are blocked probably because it was a chlamydia infection, but she never knew she had it because she never manifested any symptoms. So it's something which it's good to always have it just checked, so that you rest at ease that there's no urinary infection, there's no urethritis process which is going on. It's good for both for you and also for your partner. Yes.
You've talked about the same condition having different effects in men and women. Like you've said, I don't know if I can pronounce that word now. the one that now has could cause secondary infertility in women. If chlamydia, yes, chlamydia. If it persists and it's not treated in the woman, what about in the man? If it still persists, would it cause any problems with infertility? Or?
In the man, it might not cause infertility. In the man, it can cause a few issues. The infection might spread, and it might spread all the way to the prostate and cause something called prostatitis, which now that time somebody gets symptoms and they actually become sick. It can spread all the way to the testes. And now this is somebody who, at that point in time, they are very, very uncomfortable and they need to seek treatment. But many times that doesn't happen. What usually happens is the urethra, which is a tube which connects the bladder to the exterior. Urine comes from the bladder through the urethra going out. This chlamydia eventually causes scarring of the urethra. And that scarring, that scar tissue makes the diameter of the urethra smaller. So eventually this person notices that it's becoming increasingly difficult to pass urine. And eventually it can become so severe that this person is unable to pass urine
at all.
And they get something called a urinary obstruction. They need to go to hospital and go to theater. They relieve that obstruction. And this is somebody who needs to go for surgery. They remove those scars. The problem is those scars, even after you remove them, many times they recur. Once you have that scarring process forming, after a few years after surgery, they might recur again. That's why this is one of the issues, the cases where it's easier to just treat it early, and make sure, like if you're having symptoms, just make sure it's nothing. Go and have it checked. Yes, it's important.
All right. This is one of those that. That one, one would regret many, many years later.
That's true.
Okay. The next one. All right, this is a question that I must say I somewhat relate to. This is a gentleman who says
Yeah.
there are times he just wakes up tired.
Yes.
And, you know, he says, okay, it's quite normal, and he wouldn't be really curious about, you know, times when he knows he hasn't slept enough.
Yeah.
He sleeps late and gets up early. That's quite normal. Waking up tired is quite normal. But there are times when, you know, he's not had that that much of a physically strenuous day, and then he sleeps early, so he's had, in fact, he says about 8 hours of sleep, and still wakes up tired.
Yes.
So why would that happen? That
Okay.
they say between 7 and 8 hours of sleep for an adult
Yes.
is, you know, more than enough.
That's true.
So if he's getting that much sleep and still waking up tired, what could be wrong?
What could be the issue? Well, it's true that, I mean, in terms of quantity, 7-8 hours should be enough for most people. In fact, many people do it less. But there's another element. There's quality also. You know, you could have quantity of sleep where you're sleeping for 8 hours, but how is the quality of your sleep? And when somebody comes and tells you that I sleep for 8 hours and I'm waking up very tired, probably there's an issue with the quality of the sleep. There might be a number of things which might be causing an issue, such that if you look at the quality of the sleep, it's not very good quality sleep.
And define good quality sleep or poor quality
deep sleep. You see, maybe, I mean, poor sleep, this person who might be sleeping, but they are mostly semi-awake even in their sleeping. They are not getting the restful, you know, that restful sleep. You sleep and you dream, and even when you wake up, sometimes you don't even know where you are. It was deep sleep. Many people don't get that. There are many things which can do that. I don't know how old this person is, but one of the commonest cause of that, especially this sleep where somebody doesn't notice, because you see, in terms of quality of sleep, most of the time if you have poor quality of sleep, you will notice that my sleep is poor. You'll notice that I'm tossing and turning. You'll notice that I am semi-awake. I'm sleeping, but I'm basically aware of my environment. You might have a few episodes within your sleep of insomnia, or you wake up and sometime you notice, yeah, I'm a bit awake, then you go back to sleep. Yeah, so if you look here, I slept from 10 to 6 in the morning, but at 2 o'clock I was awake up to 3:30. You see, those ones you notice. But there's a common cause of this kind of reduced sleep quality where somebody doesn't know, and it's quite common. Yeah? It's something called the sleep apnea. Sleep apnea is one of the commonest causes of somebody waking up tired, and they look back, they feel that they slept. Yeah, it's one of the commonest causes. And in sleep apnea, what happens? This is somebody who probably snores a lot. I mean, he doesn't know he snores. He might need to ask his partner if he snores. But this is somebody who probably snores a lot, and might be somebody who might be a bit on the overweight side. Might be a smoker, because all these things predispose. Now, in sleep apnea, what happens? This is somebody who goes to sleep, then they start snoring. They start snoring. They start snoring. Eventually, the upper airways block. Okay, and when they block, for a while, he stops breathing. He or she stops breathing. They are sleeping, and when that happens, the brain senses this person is not breathing anymore. So everything gets, I mean, the person wakes up, semi-wakes up. He chokes a bit, he grunts. So this is somebody who will be snoring, and then it reaches a point he stops snoring, and then he chokes, so there's a bit of a grunt, and then he goes back to sleep. Yeah, he doesn't know, he will not notice that. He will still continue doing that. Now, during those episodes of that's what we call apnea, where this person stops breathing and
wakes themselves up.
Yeah, they get this episode and then they choke and they wake up. Yeah, it's called an apneic episode. Yeah. During that time, the oxygen levels of the blood actually dip a bit. Now, this is somebody who can get about 400 of such episodes in a sleeping bout at night. Now, they are sleeping, but they are getting all these episodes of interrupted sleep because of the apneic episodes. And during these apneic episodes, the person almost wakes up, they don't quite wake up, they change a bit of posture,
So
and then they sleep.
eventually the whole night you've been sleeping a bit, waking up.
Yeah,
a
sleeping,
bit and
waking up. But the wake up moment did not quite reach your consciousness, so you didn't even notice that you wake up. So this is somebody, if you ask them, they will tell you they just slept. But somebody who is observing them, in fact, this is something which is observed by the partner, somebody who you sleep with, or somebody maybe in another room. If the person who observes them is the one who notices, this is somebody who is really, there's a problem here, because they keep having this choking episode. There is no choke, no choke, the whole night. So this person wakes up in the morning, they're very tired, because they really haven't slept. Yeah. They probably will be having a bit of a headache. In the afternoon, they'll be very sleepy, because he is somebody who hasn't slept. But they can't remember. If you ask them, do you have insomnia? Do you have difficulty sleeping? No, because as far as you are concerned, they slept. Yeah. So it's a very common cause of this. Yeah.
So what do you do with sleep apnea if a person's airways close? How do you help a person like that to now have quality sleep?
Well, there are certain things which you can do, because sleep apnea is found, there are predisposing factors. One of the predisposing factors is weight. There's a direct link between your weight and sleep apnea. If you lose weight, then you help yourself. If you add weight, your sleep apnea gets worse. So this is somebody who you would want to exercise more. You want them to lose weight. There are certain exercises they can be taught to do. And those are exercises in the mouth and in the throat. They can be taught to do by the right person, such that they reduce the episodes of apnea. But by and large, if this person starts an exercise program, they lose weight, the apnea tends to get better. In a few people it doesn't, and in those people then you have to do other things. Yeah. And in these people, some people get, it's not common to get that kind of severe sleep apnea, but there's some people who at night they have to sleep with a certain machine, which almost is breathing for them. So when they get those episodes, the machine applies something called pressure breathing, and they keep breathing. Then they can rest. That is not common. It doesn't usually reach those levels. That is not a very common thing. For most people, it's mostly a lifestyle change issue. You change a bit of your lifestyle, you lose weight, then it tends to get better. Yes.
Okay, so that's sleep apnea. But we talked about hours. Maybe you can mention a bit about the number of hours. There's a number of hours that one requires for proper sleep. If everything is fine without sleep apnea and without all of that, does it change within a person's life cycle, like with age and with young people, say children, young people, middle age, older people?
Yes, it changes. Actually, the younger we are, the more we sleep.
The more we need to sleep.
Yes, when a baby is born, they sleep most of the time. As in a baby sleeps for like 18 hours, a newborn baby, or even more. Yeah? But as we grow older, we tend to sleep less and less and less and less and less and less. So you find that, by the time you become an adult, usually on your 8 hour, 8, 9, between 7 and 9 hours. It's variable depending on different people. Yeah. Now, when you start becoming old, you also now tend to start needing to sleep more again. So you find you tend to require less sleep up to a certain age, and then your sleep requirements start increasing again. Yes.
So that's normal.
No, that is normal. Yeah. That is when you start becoming a bit older, you might notice that you need to rest a bit more than usually you would. It's part of that is part of your aging process. Yeah. Yeah.
Okay.
Yes.
All right. I think we can take the very last one for today. Another curious gentleman who asks, I don't know why today we're getting, we have 2 out of 3 questions today on urine. But
Urine, yeah.
it's
Yes.
okay.
Yeah.
He talks about white urine.
Yes.
And gives the, you know, the idea of intermittent, I don't know that to call them episodes, so it doesn't happen all the time, but he says once in a while, or, you know, every so often, that he will notice that the urine is either, I don't know whether white or whitish, but that's what he mentions, the white color. And once again, the main question being, is that something that one should worry about? What would be causing that sort of discoloration or causing that color in one's urine?
In one's urine. Okay. Yeah. Having white urine can be a normal thing. It sometimes happens. Some people get white urine once in a while, and it's considered normal. And I'll explain. Yeah. If you take a meal, which a meal, basically a heavy meal, yeah, or if you take a lot of milk, there's an ion which is called phosphate. Phosphate levels in the urine will increase. Now, phosphate can color your urine. You can have not really color. It can make your urine either cloudy or white. But this is intermittent. You might notice it and then it just disappears. And if you're very worried about it, if you go to a lab, they take your urine sample, they'll just add a bit of an acid, something called acetic acid. If you add a bit of acetic acid to the urine, it clears up immediately. It means that it's just a lot of phosphate in the urine, which is not a bad thing. Phosphate is something which is found in food and milk, and sometimes if you take a lot, you might notice that. That is not an issue. There are also other things which can cause that, which might be an issue. Somebody who is having whitish urine, they might be having a very severe urinary tract infection. And what you might be seeing as whitish urine might be pus.
In that case, there would be some other discomfort that accompanies
There would be
this.
some other discomfort, but it depends on how long this has been there. Yeah, it depends. There are a number of factors, and it depends on what is causing. You might have somebody who is having pus which is coming out from the urine, and it might appear as white urine, cloudy urine, whitish urine. Something else which can cause that kind of whitish urine, but this is not common, is something called lymph. Our bodies are made up, the building blocks of our bodies are cells, and those cells are bathed by a fluid. Now that fluid comes out from, it comes out from the capillaries, it bathes your cells, but eventually it collects and drains through certain vessels which are called lymph vessels. Now those lymph vessels also drain certain vessels which come from the intestine, which are the ones which where fat, when you eat a fatty meal, fat enters through that. Now, if for some reason there is a communication between those lymph vessels and your bladder or any part of your urinary system, then lymph might leak from those lymph vessels into your bladder, into your urine, and you might notice white urine. That is not normal. It needs to be
because you say for some reason, which gives me the idea that there shouldn't be any communication.
There should not be a communication. That is an abnormality. So that is something which needs to be corrected if it happens. But that can also cause white urine to appear. So, as I've said, this is a situation whereby it might be normal, but it would be good to have it checked so that you rule out the abnormal things which might cause it. If you go and to the lab and they check, they find it's phosphate, they're seeing phosphate crystal in your urine check, then probably it's not something to worry about, as long as you have ruled out infection. The main thing in that kind of thing is not even this, the last thing we've talked about, is probably a sort of infection which is continuing, and it has been there for such a long time, you have taken antibiotics for something else, you're not even feeling it anymore, but some pus is leaking out from your urine. Yeah, so that needs to be checked.
Bottom line, have it checked.
Yes.
Yeah. All right, I think we have again exhausted what we have.
Okay.
I hope we've not exhausted you, but we'll let you rest, and then we'll have you back in about a week or two.
Thank you.
Yeah, we are grateful. I think we are learning. We continue to learn a great deal.
All right.
Yeah. Well, that was Dr. Paul Wanjohi talking to us, answering the questions that we had from you for this edition. And I think the bottom line of what we keep learning every time we have this show is, you know, as much as you have this nagging little problems, the best thing you could do for yourself is have them checked. You're better off finding out that there is absolutely nothing to worry about than regretting later. I have been your host, Marianne Waisha. Remember that we'd absolutely love to hear from you, to get some feedback from you about the MedFiles program. You can use the SMS line on your screen, that is 22330 22330. You can use either one of the email addresses that we have. We have medfiles@3stones.tv. And if you'd like to get in touch with Dr. Wanjohi directly, you can use his email address, that is wambakiwanjohi@gmail.com. wambakiwanjohi@gmail.com. If you'd like to have any further inquiries with the doctor, you can do that directly, and even perhaps get to his clinic and have some of these things checked out, as we have said. See you next time. I have been your host, Marianne Waisha. Audio Jungle. Audio Jungle.